Welcome back to our ECG class. So we have some objective of this interpretation. This is just me trying to just summarize what you might need. When you assess the P wave, what you're trying to look at, if it's a sinus reading, you want to know if it's actually a supraventricular reading, which is reading pace above the ventricle. So, and most times when you use supraventricular tachycardia, for example, it's a very fast reader. You're not seeing the P wave. You don't know if it's the SA node or if it's, but you are suspecting that it's not the SA node most times. So you want to check, if there's atrial fibrillation, you check the atrial size as well, also for atrial hypertrophy. PR segment, whether it's depressed or elevated, you want to check for pericarditis. Also the duration, if it's short or you know too much, you want to check for junctional reading, AV blocks. Also PR interval also is you use AV blocks as well. Check for AV block. If it's prolonged more than 0.20, you're thinking of heart block. Whether it's first degree, second degree, or third degree, you'll be able to do that. Also, when it's short, you're thinking of Parkinson-White syndrome, junctional rhythm, KRS complex. If it's wide, you're thinking of ventricular rhythm. Also, when it's wide, you're thinking of bundle branch block. When it's wide, more than three small boxes. So, also ventricular hypertrophy, voltage criteria, you use your KRS complex. Also, for KRS axis, you use your KRS complex, whether it's left axis deviation, right axis deviation, or extreme axis, or normal axis. Now, long Q wave as well, use your KRS complex to see for ODMI, J points, you use that for your early repolarization. Also, the ST segments, you use that to check for myocardial infarction, either ST elevated, early ST elevation myocardial infarction or non-ST-MI. So calcium level, when it is short, it is hypercalcemia. When it is wide, it is hypocalcemia. Bundle branch block is depressed in bundle branch block. Ischemia is depressed in ischemia as well. So T wave also reflects ischemia. Hyper or hypokalemia. When it's hyper, you have a tall tinted T wave. So QT interval, okay, use it for bundle branch block too. In bundle branch block, you have an inverted T wave, also in strain pattern as well. So QT interval, when it's prolonged, you're scared of torsade epontis, which is sudden heart, sudden patient death. They are judged by ventricular tachycardia to with prolonged QT interval. Here we'll be teaching you how to calculate heart rate. One of the methods that we use to calculate heart rate for a regular reading, whereby the RR interval is regular, we can say 1005 divided by the number of small boxes between an RR interval. We use mostly lead 2. So when we do this, we get the heart rate. So if they want to use the small boxes, you can use big boxes. This is just to show heart rate is 1 minute. So if I say 25 millimeter equals 1 second, so 25 times 60, that will give us what? That will give about 1.5. So that's 1,500 millimeter equals 1 minute. So we can use that to calculate. That's how they got this 1.5. So here we are using 300. That's just like 5 big boxes equals 1 second. So that's 5 times 60. That will give you 300. Just narrow your mind down to this. You can play back the video to be able to understand what I was saying. So this 300 divided by number of big boxes is to give your heart rate. Number of big boxes between the RR interval. So this is applicable to regular reading only. Another formula you can use when you have a regular reading. Irregular means the RR interval is not regular. So you can count 30 big boxes on the 2 reading strip. That 30 big boxes that you have counted is just 6 seconds. Yeah, it's 6 seconds. So that space, just like now, a big box, 25 millimeter equals 1 second, Abi. So that's 5 big boxes equals 1 second. That's like 30 big boxes will be equal to 6 seconds. So I need to just know 6 seconds. So 30 big boxes. Now you count the number of KRS complex you have in that during that span. So if you have 10 of them, that means you have, like, let's say if you have 4 of them, that is 4 beats in 6 seconds. How many beats will you have in 60 seconds? That is times 10. So 4 times 10 will give you 40. So if you have 4 beats in 6 seconds, definitely you have 40 beats in 1 minute. So that's the way to. But in modern days, this one is used for old machine. Modern days now, the rhythm strip is in 10 seconds. So it's very easy. Just count the number of KRS complex in your rhythm strip, then you multiply by 6, and you get your heart rate. So one disadvantage of these 6 seconds is that it gives the answer in tens, like in a rounded up figure. You can't get 44, you rather get 50. So it gives it a 10, 10, 10 because you are multiplying by 10. 2 times 10, 20. 3 times 10, 30. So like that, it's going to give you rounded up figures. This is a cardiac ruler method that you can use to predict heart rate very fast. So when you know that between if one box is between the RR, this is a regular RR interval. Now you can see R, 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 like it's regular. It's not wider than the other. So this space now is the same as this space. This space. So definitely. So if it's just one box that is between this RR interval, automatically 300 divided by 1, it will be 300. So the rate should be 300. Now if it's two boxes, only two boxes that is between, so the rate should be 150 because 300 divided by 2 give 150. So like that to 6. Now this cardiac ruler now give us a shortcut which I use for heart rate when I even for my job interview I still use the trick and they didn't get because the big boxes was just 4. So I just told them the rate is 75. And they were like, hey, magician, you didn't even punch calculator. You didn't. No, no, it's just this cardiac ruler method that I made use of. So if your big boxes is between 3 to 5, it's a normal rate. So you get a rate between 60 to 100. If you have 3 to 5 small big boxes. But anything less than 3 will give you tachycardia. So if you have two big boxes, it's tachycardia. So if you have anything more than 5, it will give you bradycardia. So that's one way to know if it's a normal rate or bradycardia or tachycardia in the ICU. Just need to count the number of big boxes between. Just like this one now. Looking at this, mere looking at this, you can see that this is up to 3 boxes. This is 3 small boxes and this is like 2, this is like 3. So I know that the rate of this should be like 100. But if I want to calculate, so I might get maybe 98, 99, but it's still like 100 because it's 3. You can see it here, 3. You can see clearly here. I think this one goes with this. You can see 3, but it is slightly more than 3, just half of a small box. That's why I say you'll be getting 98, and because it is anything more than 3, we actually give you a normal range, but less than 5, I will give you a normal range. But anything less than 3, give it tachycardia. So this is not tachycardic. So let's go to now. Okay, let's go to the cardiac rhythm. Before we go to cardiac, I'll just show you how to calculate heart rate. So let's use this for example. Using the big boxes, someone can just do the math. Like if you should come here, let's start from here now. 1, 2, 3, then we have like 3 small boxes here. That's 13, 18, 18. So we can say 18, 1005 divided by 18. What you get, you write it down. So the same way, if you are using big boxes, just say 1, 2, 3. 3 big boxes, but they are left with 3 small boxes as well. 3 small boxes are left. So what do you do with the 3 small boxes? So what we do is that, like this now, let me see. Yeah, what do you do with the 3 boxes left? You just say, okay, the 3 boxes in one, that is 0.6, because one small box will be 0.2, 2 will be 0.4, 0.6, 0.4, then 0.8, then 1. So that means that I will not say 300 divided by 3. I will just say 300 divided by 3.6 because I still have 3 small boxes. So I just need to know the value of the 3 small boxes, not that I should just dispose them. You and I, if they give us 1.3 million now, will you throw away the 300,000? No, now you will try to look for the value of the 300. So the 3 small boxes, because you're using big boxes, doesn't mean they don't have a value. They are not up to 1, but they have a value. So and that is 0.6. Because if you should do it that way, I'm saying 300 divided by 3, and you say 1005 divided by 18, you get different answer. It will not look as if the formula is giving two different answers, but you don't have make a mistake. You omitted or disregarded the three small boxes that were left over. So that was a sinus reading. That was a normal sinus reading. So this sinus tachycardia, you can see the first thing you look for in sinus tachycardia, in a sinus rhythm is the P wave. You can see the P wave in the two is normal. This is a normal P wave. You can see it's upright, it's single, it's uniform, and has all those criteria. It is also round and all that. So, but the rates here, you can see that the big boxes between these RR interval is like 2. So definitely this is 300 divided by 2, that's 150. As I've told you, anything less than 3 is tachycardia, and you can see sinus tachycardia. This is 2. The machine is being calibrated 25 millimeter per second, so always watch out for this. Now this is sinus bradycardia, because if I start counting, the P wave is normal. See the P wave here. You can see P wave. P wave is normal, so it's a sinus rhythm. And the KRS complex is narrow. You can see RR interval is regular. It's regular, but the only issue is that if I count the big boxes here, 1, 2, 3, 4, 5, 6, it's more than 5. So this is bradycardia. So you can now calm down to calculate your rate by making your 1005 divided by blah blah blah. So this sinus arrhythmia, the reason why this is a sinus arrhythmia is that your P wave is normal, it's a sinus rhythm, but the RR interval is irregular. So this is a sinus arrhythmia. To calculate heart rate here, you don't count the number of big boxes like this. What you need to do is you count from here, like 1, 2, 3, 4, blah 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 to about 30. So let's say our 30 got to this place now. Then you just need to count. If you count the big boxes from there, if it's 30, because of time I can't do that. So let's say it's ends here. All you need to now do is you count the number of R wave. 1, 2, 3, 4, 5, 6. So you just say 6 times 10, that is 60. So the rate is 60. But on the norms, from here to here should be 10 seconds. So I just say 1, 2, 3, 4, 5, 6, 7, 8. So like that. Like 1, 2, 3, 4, 5, 6, 7, 8. Wait. 1, 2, 3, 4, 5, 6, 7, 8. My eyes, sorry. So that 8 now. 1, 2, 3, 4, 5, 6, 7, 8. So you multiply by 6. 8 times 6. So that will give you your heart rate. So you just say 8 times 6. That is supposed to give you a heart rate. This is supposed to be 10 seconds. But you can use your 6 seconds to be able to get familiar with this very. This is an example of heart block. You can see a first degree heart block. You have a PR interval that is prolonged and consistent like that. That's a first degree heart block. Second degree heart block type 1, it is prolonged and is progressively increasing. You can see that this is different from this is wider than this. Then you have a drop in KRS complex. There's a P wave, but there's no KRS complex. Then there's another P wave and the rhythm continues as if nothing happened. Then later there's another drop in KRS complex as well. So in second degree type 2, the PR interval is prolonged but it is fixed, just like what you have in first degree. But the difference between this one and second degree type 2 is that there will be a drop in KRS complex. Now in type 3, in a third degree heart block, you don't have good relationship between the PP and the RR interval. So the PP is normal, the RR interval is normal, but it's more like consistent drop in KRS complex happening, and it's a very dangerous reading. The second degree type 2 is as well dangerous because type 2 happens the um, below the AV node, into the ventricle. It's going already into the ventricle, so it's more dangerous than even type 1. But type 1 can turn to type 2. Now this is an atrial rhythm. Now we are in atrial rhythm now. One of the features of atrial rhythm is that they don't have normal P wave. So you can see one here is having inverted P wave. And if you look at the rate, the big boxes here is less than 3. So this is atrial tachycardia. And one amazing thing about atrial rhythm is that it's different from junctional rhythm. Junctional rhythm does not appear as segments, but you can see here there's a pair of segments. So these are under atrial rhythm. You can see the P wave inverted and there's pair of segments. But when you count the number of big boxes now, one, two, three, and half. So that's more than three. So this is not atrial tachycardia anymore. This is an atrial rhythm, but we don't call it atrial tachycardia because the rate is, should be less than 100 using that cardiac ruler method. This is an example of atrial fibrillation. Two things: irregular rhythm and irregular P wave or fibrillatory wave. Irregular. So you can see the RR interval is irregular. Then there's no P wave. All these things that look like P wave are just fibrillatory waves. So this is an example of atrial fibrillation. This is an example of atrial flutter. You can see that everything is looking like a sawtooth shape. Like if someone should take this to cut your hand off, like all those orthopedic surgeons. A joke, oh. So um, this is looking like a saw tooth. There's no period there. So what you have is, so they use block. You can say 2 block, 3 block, and all that for this. Ventricular tachycardia, one of the differentials of wide KRS complex. You can see that the KRS complex is wide there consistently, and the rate, if you look at these big boxes, it's not even up to 2. You understand? So in that situation, that's tachycardia, so ventricular tachycardia. The KRS complex is wide, and P wave is absent. You can see the KRS complex wide. You see it wide like that. And also in this reading now, there are other things that you can see a bundle branch block here, right bundle branch block. You can see extreme axis deviation. You can also see poor RF progression. You can see everything going down. It's supposed to be upright, but it's good. So actually, probably a lead misplacement or possibly present there as well in the previous slide I showed, because I think the KRS complex in lead 1 is upright. It's meant to be negative. So this is an example of premature ventricular complex. It also happens with a wide KRS complex and inverted to a sudden change in morphology of the KRS complex. It just come up, you can see it there. So this is how the KRS complex was looking like this. Suddenly they just see a giant one. So when you see it in your cardiac monitor, it's just a premature ventricular complex. Now it gets dangerous when it's multiple, patients experience palpitations. Now this is a perfect biphasic KRS complex to calculate KRS axis. You can see in AVF it's perfect. So in this situation, all I just need to do is to go 90 degree, and that will give us about 0 degree for the KRS axis for this patient. I notice that the P wave is inverted there. You can see. So this situation now, there's negative where there's positive where there's a right axis deviation. Now this is an example of right bundle branch block. You can see the KRS complex is upright, and you have seen the RSR prime pattern. So when you see it here, it's right bundle branch block, and that right bundle branch, you can also see right axis deviation in that wavefront. Here is the left bundle branch block. You can see that the KRS complex is consistently wide in these blocks. You can see. So and you have the RSR prime in V5 V6. So this is an example of poor R wave progression. You can see that it's upright. It's of it to be negative here, according to the KRS complex is now positive here, positive here, positive. No, no, no. So this is a poor R wave progression. Which ventricular block is this? So this is more like a left axis deviation, and when you have left axis deviation with R wave here greater than 11 in AVR, you'll be thinking of left posterior. This left posterior fascicular block. And you can look at these So this is a rule to know left axis deviation. You can see in lead 1, lead 2. Lead 1 is positive here, is negative in lead 2, so it's left axis deviation. Negative in lead 1, positive in lead 2, right axis deviation. One is negative in lead 1, negative in lead 2, extreme axis deviation. So this is an example of left axis deviation. You can see left anterior fascicular block, sorry, anterior, I mean anterior then. It's when it is right axis deviation that is posterior. Apologies. You can see a poor array progression here. You can see normally it's supposed to be negative here truly, and it is, but here you can see that it's negative here. The positivity here is not shooting up well and all that. So it's a poor array progression. Now, what I mean by R rate progression means that R will be consistently increasing, not that the V1 will be greater than V2. No, it should be consistently increasing. In V1, it will be smaller. In V2, it will be taller. Then in V3, it will now be taller. So it's progressively increasing. That's what we call progression. This is a normal T wave here. You can see a T wave is normal, but in some cases, you might have abnormal T wave. Like here now, you have a tall T wave, but it's not that tall. It's not really that tall, so it's not that tall, but it's still tall. Shows a tall tinted pattern, but it's not too tall. So thank you for today's lecture. Have a great day.